Or to walk, yes, absolutely, or to walk-in clinics.
All right.
Even now, one person that sees a doctor at the walk-in clinic the doctor is going to get paid $32. Now, where is the cost savings? This is what Christine Elliott was just saying. The ramifications of this cutback has not been examined properly by this government. They are going to pay somewhere else the same costs that they're taking away from the independent pharmacists.
Rajiv, thank you.
Pharmacists will be going out of business.
I got a lot of people here I want to get on the air. A quick word from you, then I'm going back.
The proposal, albeit not in hard ink yet, says very clearly that when the pharmacist provides that service that he describes, that pharmacist will be paid for that service.
So if he spent time with a young mother, he'd be paid.
He can charge for it.
But we don't know those details
yet, do we? Well, that's true. That's valid, and that's a valid point. But if the point is that they will be they will be paid.
All right. Ben Chenoud saying it's not true. What's not true, Ben Chenoud?
That's not true that that we know this for sure. The government have put another $50 million, and they said that this is for MedCheck, have been consumed $12.5 million. They can put whatever number they want on the table on piece of paper.
Yeah.
But pharmacy will not be able to get it because of the practicality and day-to-day workload we have in the pharmacy. It's very nice to come and say, I will give you $100 million, but they know for sure that we will not even touch 20 million out of it.
Christine Elliott. Let me hear from Christine Elliott what Ben.
There's still so many unknowns here, so many variables.
The devil is in the details, and we don't know the details. Isn't that really something we can all agree on?
The government needs to go back and have a real consultation with the pharmacists so they understand the full ramifications.
But not in the middle of the war, I guess, eh?
Well, they're not willing to. The government is only willing to come back and talk about the $100 million allowance and how that will be doled out in rural and underserviced areas. We need to take another look at the big picture and what's going on here and get a solution that suits everyone.
All right, thank you, Rajiv. Here is Sheila calling from Toronto. Sheila, what do you think about all of this? What's your opinion?
Hello, I'm not a pharmacist.
Oh,
we're hearing such a lot from pharmacists.
Well, you're not, so go ahead.
I'm not. I like what Susan Eng has been saying. I think that the very aggressive reaction taken by the pharmacists and the pharmacist chain diminishes their professional reputation. They encounter the situation every day of ordinary Ontarians coming to their counters with a prescription, asking how much it will cost, and walking away because they do not have enough cash to fill that prescription. And so this huge focus on, are the pharmacists going to do all right about it, is one aspect. But let's not forget that there are people who need medications, and that certainly does have implications for, for our emergency rooms and for the rest of our health service, who simply, they don't have any kind of coverage, and they simply have no way of paying the high costs of some prescriptions. So this measure will put a lot of medications within their reach. And I'm so disappointed that these pharmacists who encounter people day after day are responding to this without acknowledging that.
Okay, let's go to Ben Chenoud about that. Ben, how do you react to what Sheila's saying?
I think Sheila is very emotional about the government. I don't believe that Sheila have really...
She's very emotional about pharmacists, by the sounds of it to me.
I don't think so.
Well, that's what it sounded like to me.
Spend 2 hours behind the counter, Sheila, and you will understand why pharmacists are so outraged. Because we see, as you said, that I have patients coming to me and saying, price this prescription, and they walk away. In the meantime, I have patients on the phone. They are puzzled about taking their medication, and I help them. If I don't have the time or the ability to help them, they'll be lost. I have patients coming to my counter crying because her husband is at bed and she cannot have an appointment with the doctor, and she's crying and asks me to help. And then I call the patient, I try to triage the patient and send them to the hospital, send them to the doctor, or do something to help him. This is the role of pharmacists. The role of pharmacists is not counting pills and shuffle it in a bag and give it to you.
Yeah, but that's part of it. This is certainly part of it.
This is the start of it.
Yeah.
But the main care we provide is much more complicated than that.
All right.
And if the government will take the money and blind Ontarians about the prices, what about the service? Can Sheila get the medication and nobody talk about the medication? You just put it in a bag and here you go?
All right, let me get some more calls on. Here's Ray calling from Pickering. Ray, what do you think about this? Ray, go ahead, please.
Hi, I've got a question for Ben.
Yeah.
The number of patients that actually come in that only pay cash prescriptions, what would you say that would be? Because I have a drug plan, my family has a drug plan, my parents are seniors. How many people actually come in and just pay cash?
Just pay out of their own pocket for drugs.
Yeah.
What about that, Ben?
About 5% to 7% of the total number of prescriptions of any pharmacy.
So really, 5 to 7% of Ontarians are actually going to save money on the cost of a generic, because everybody else has either got some sort of a drug plan or is on Ontario Drug Benefit. So really, the big savings is going to be the insurance companies, because they're going to have a huge savings on the generic price. Obviously the government, because they're going to have a huge saving on the generic price. But ordinary consumers who just pay cash, 5 to 7% of the people are actually going to have a savings. So I guess my question is that if the government is turning around and cutting the price of generics, then who is actually going to benefit from this? It seems to me it's going to be the government, because in the end...
And insurance companies.
And insurance companies.
Yeah.
And again, it's going to be the industry. So it's going to be GM, Ford, Chrysler, whoever's got a hand in the government's pocket saying, how are you going to help us out?
Meantime,
we're going to move south of the border.
Meantime, the clients may have to pay an extra delivery charge.
Exactly. And then you're going to have your first caller who sounded like he was in poor health. And now all of a sudden, his $2 copay is not going to change. Is the government changing the $2 copay or the $6 copay? They're not. So now how is the pharmacy going to pay somebody to get in a car and drive to this gentleman's house and give him his prescription for free? The price of gas is $1 a liter.
Yeah, that's right.
It's not going
Ray,
to be affordable.
Thanks. Let me get some reaction to what you're saying.
Well, first of all,
from Susan.
The money that is saved, all right, the government's money, the part that the government pays for, that they have committed to keeping that money in the drugs budget. So to cover new drugs, to pay for these counseling services and so on. And I still don't
So it may be more than $100 million?
Well, it could be, and I think we could advocate for more. But somehow I don't understand why people keep saying I'm doing it and somehow somebody else is going to pay for it. I don't understand why they don't believe the government is going to pay them for their services. But that aside from that, then the next point is that the drug plans that are privately put out are often self-insured. It means that those plans too can be better negotiated. They will cover more drugs. You can get better terms. And the rest of us who pay for it ourselves will also benefit. So actually the reduction in generic drug prices helps everybody.
Although in the cases that were cited by Ray, if your prescription's already paid for by your insurance company or paid for by the Ontario government under the drug plan, you don't personally save a buck on that.
No, but we all do. We have to get away from the idea that it's somebody else's money. This is all our own money.
We know where it came from originally,
These are tax dollars that we're trying to we're trying to get value.
In other words, it's more money to benefit the whole system that's being saved.
Well, of course it does. That's the point.
Okay. Christine Elliott.
Well, it is a small group of people who will actually directly benefit, but again, it's a false economy, because you're going to see all of these other things that are going to happen as a result of this. I know that a lot of the hospital pharmacists are very concerned. They can see this coming. They know there's going to be a flood into the emergency room of people. This is the counseling that pharmacists do on a daily basis, and they're not looking to be greedy. A lot of people they're being vilified, quite frankly, by this government with some of the things that the government said about them and the minister.
Well, that's why we call it a war, because it's getting pretty heated, isn't it?
But they're a small business after all, and the Canadian Federation of Independent Business has come out in support of the pharmacist's position, because they're entitled. They're well-trained professionals.
Let me try to get one last quick call on before the break. Here's Gabrielle calling from Ottawa. Gabrielle, what's your point you'd like to make about all of this?
Thank you that's kind of a great segue actually to what I was going to talk about. There are actually savings to the healthcare system to have pharmacists working. I'm a hospital pharmacist, but I also moonlight in community often. And a lot of times I actually see men who are sweating profusely, going to buy Rolaids, and I actually go to them and say, excuse me, you really should be going to an emergency room, because they may be having an MI. Sorry, heart attack.
Myocardial infarction.
Yeah, exactly.
Yes. Okay.
So a lot of times, actually, when a patient comes to the pharmacy, we actually can diagnose them, or not diagnose them, but refer them to the hospital a lot faster than they may have gone, saving taxpayer dollars, because they get to the hospital, they're not on life support or in a really bad situation when they get there. And there's also something else that I think people kind of miss. I don't know how often people go to the pharmacy and the pharmacist actually does not sell them anything. They counsel them and they tell them, you know what, you actually should be doing this, this, and this.